And welcome back to Sunday House Call. Now for our segment, Should I Worry?, in which we every week talk about something that worries us. One viewer writes, I'm a 72-year-old female with a family history of coronary disease. My total coronary calcium score is 480.9. Total calcium volume is 330.6. Should I worry? Dr. Samadi, I have no idea what any of that means, number one, but what is a coronary calcium score? How do I get it, and what will it tell me?
I thought you were going to ask me what my calcium score test was, which I just got it 2 weeks ago, and it's 0. What does that mean? What does all of this mean? Yeah. We're basically looking for a plaque in your heart. The arteries, coronary arteries that bring the blood flow to your heart, they can get blockage, they can get calcium, atherosclerosis, or that plaque, which leads to angina, chest pain, and heart attack. If you can get a CAT scan, a non-contrast CAT scan that can look at those arteries and say how much calcium you have there, then you have the score. And this is available. A lot of insurances may or may not cover it. It's about $350 or so. So you would go there. It's about a half an hour, just like getting a CAT scan. And they look at your heart and say your score is 0. And if it's less than 100, you're okay. Somewhere between 0 to 100, it's about mild heart disease. Between 100 to 400 is moderate, and over 400, which is this patient, you would be in trouble. Why is this important to know? Is because we can tell you, listen, it's time to change your lifestyle, fix your blood pressure, you're heading the wrong direction. So as a prevention, I love this topic. The issue with calcium score tests, and he's going to be impressed by my research, is sometimes you're not going to be able to see very soft plaque, which is not calcium in it, and then you have to go for angio and other things.
Soft plaque?
Well, it can lead to heart attack, which won't show up on this. So that's a false negative for this test. But I like it. It's very quick. I went in because I was under stress. The staff wanted me to check myself. I came out, 0 calcium. You should be proud of me.
Very proud of you, and I'm relieved now you have low risk.
Thank you.
Would you recommend this, Dr. Siegel, to your patients? Like you're thinking, you just out of curiosity, go in an MRI and get this done?
Well, start with, I like this test too. But I want to say, I start with patients by asking, what are your risk factors? And in this case, the patient has a family history of heart disease. That's a biggie. So I'm already putting that patient in a category. Should I worry? Well, I'm a little more concerned. Are you a smoker? Do you have high blood pressure? Are you overweight? Do you have diabetes? These are big biggies that would make me want to think about getting a calcium scoring test. Here's why. The coronary arteries are tiny, Eric. We extract almost all the oxygen we can out of them. And you know what? They're so easy to block. And once they block, and they have to be 70% blocked before you're going to have symptoms. Well, I want to know. I want to know when you're on the road to having symptoms.
Absolutely.
And you know what? This calcium scoring test, because when you have injuries to your arteries, they get more calcium in them. So over 400, as David mentioned, that's already a red flag. You have over 400, I'm going to get you on a treadmill, do a stress test. I might even be more aggressive and do something called a CT angiogram, which I look to see exactly how blocked you are.
Right.
The difference between a calcium scoring test and a stress test is that a stress test looks to simulate angina to see if you have symptoms. This gives you an anatomical view of exactly how blocked that artery is. And someone at risk, I want to have this test.
Quickly, Dr. Samadi, bringing you back into this. I mean, what about, this lady has a family history of coronary disease, but what about cholesterol, blood pressure, if you have high blood pressure, race? Do any of those factors come into play here?
Absolutely. Even gender, and we see that sometimes even postmenopausal women, they are at higher risk. So your point is well taken. As a detective, you're going to look at this patient and say, these are the risk factors, and I want to find out exactly what's going on in your coronary arteries. Oh. Once you do that and you get that score, now you're on your way to whether you want to get the stress test or whether you're going to go to angio. Maybe that patient may need a stent or not. So as a prevention, I like this study. I don't think everybody out there should go and get this test, so be careful with this. But for people that are at moderate to high risk, I like it.
One final point on this. You brought up the one risk factor I forgot to mention, Arthel, which was cholesterol. And you know what? Cholesterol correlates directly with those plaques in the arteries. So if you have a high cholesterol, I would especially want to do this test. And here's another thing. With lifestyle change, which David and I have talked about a lot, you can reverse it. It's not always taking a drug.
Good.
Lose weight, get on that Mediterranean diet, and lose
But listen
weight.
to what he just said. If you know about this, you can reverse this whole mechanism. And there's a lot of inflammatory process that's going on in these plaque that you can slow it down. Coronary artery disease is the leading cause of death among men and women. That's why it's important to know this.
We follow a trend on this test. We follow a trend to see how much calcium you build up over years, the same as we do with a PSA, with a prostate.
Well, he likes the olive oil and Mediterranean diet.
Coronary calcium test.
Very good.
All right.
So